The three primary ways that we treat patients with colorectal cancer are typically going to be open approach, which has always been the historical incision down the middle and colon resection. And that has been the standard for many years. And then laparoscopic techniques developed and became more common in the 90s and in the early 2000s. But still, as recently as 5 years ago, colon resections in the pelvis were still done in an open fashion. Robotics, which is the advancement of laparoscopy, where we use a robotic cart to adapt. We adapt those arms to the ports that go into the patient. Those allow us to be more facile. We operate from it translates us as a surgeon into the robot. We use the robot to be more precise, and it's allowed that number where the vast majority of colon resections, even 5 years ago, were still done in an open fashion. It has now allowed that to be the primary, certainly for me and for Dr. Tanshu, but that has allowed the expansion of minimally invasive surgery. Robotics, like as I was saying earlier, is an advancement in laparoscopy, where we use the interface of a robot to attach to small ports that we place into the abdomen through incisions, and then that allows us with our hands, where we are in the surgeon's interface, to be very precise, to be able to minimize bleeding, to optimize outcomes, to reduce complication rates, and that has been probably, certainly in my career, now that I've been doing robotics for 7 years, starting in 2013, which was was pretty early in the realm of colorectal surgery, has been significant in reducing complications, hospital stays, improving patient satisfaction, in reducing lost days due to illness for work, and certainly reducing pain. And it's always interesting to see patients who don't quite understand what we're going to do and explain that to them, and then when they go beyond the surgery and they finish and they say, wow, I had no idea that this could be done. Occasionally you'll find a patient who had surgery on their abdomen back in the 90s, and then they'll have a surgery that I do with a robot. And they're some of the most fun patients to talk to, because they say, this is so different, because they have a reference point. It has revolutionized surgery in colorectal cancer and all colorectal maladies.